There. Hi, I'm Andrea Mounce-Halasz. I'm certified personal trainer, fitness instructor, exercise therapist, and osteopathic manual practitioner. And I'm here today to share with you, hopefully, a simple technique that you can do to help ward off knee pain and or help whatever potential knee pain that you may have. Now, this does not substitute your work with your therapist, your physiotherapist, your osteopath, your physician, whoever you're going to for your knee pain. Make sure you follow their advice. But if you're stuck and if you're hurting and you want to try something, this is worth a try. Okay? So this is knee pain that presents itself either usually on the lateral side or the medial side. And it's because this particular one that I'm going to show you, I mean, there's many reasons for knee pain, but this particular one is because the tibia bone happens to be more rotated one way than the other way. Now, the tibia bone is a large bone. This is your fibula on the outside of your leg. Your tibia is this large bone here. Now, I'm going to be doing it on my right leg because my right leg is the one that I have to do quite regularly, especially after golf games. Why is that? Why do I have to keep doing it? Well, I broke this leg quite badly in 1979, so it was a long, long time ago. And yes, even after all these years, it still gives me troubles. However, if I keep on top of it, it does not give me troubles. So even if you haven't had a fracture, you may still have to do this. Maybe you had a bad sprain that you don't even remember, and you still have to do this as a preventative maintenance thing, especially all you sports folks that have done many, many sports. You've had so many twists and turns in those sports activities that you probably don't even remember. Now, so you can do it like so with your foot up on a bench or a chair. Just turn this. And you're going to come right up underneath a joint line. Or if you prefer, you could do it seated like that. I like to do it standing. I just feel I've got more control over it. But feel free to do it sit. If you're bending over, make sure you bend at the hips. Again, this is the same for whatever leg you're using. Slide up so that you're right at the joint line. So I'm using my hands like this. My thumbs are behind my knee. I slide way up, way up, way up, way up, way up. And I connect to the tibia. And if you're not sure what the tibia looks like, check it out on Google. I'll attach a picture of a tibia bone in the comments of this video. Now, really grab it and notice, does it rotate left, back to center, more than it rotates right? All right, just notice, is there a difference? If they rotate left, rotate right, pretty much the same, you're probably okay. And that's not the trouble. You probably need to try a different approach and or find somebody to help you out with this. Mine rotates left more. So I'm going to take it, and the pain for me is right here on this lateral side. So I'm going to take it to the left, or medial, if it's called. I'm not going to force it. I'm just going to take it to where it doesn't want to be taken anymore. This is a very subtle movement. There's no forcing. There's not yanking, cranking, snap, crackle, popping, none of that. You're working with, dialoguing with the tissues. Okay, so my knee doesn't want to go, my tibia does not want to go left anymore. Now I wait, and I wait. And you may miss this, but right now my tibia starts to turn back to the right. You may miss that because it's quite subtle. It almost turns on its own, but now I'm guiding it. I'm guiding it to the right. I'm guiding it, I'm guiding it, I'm guiding it. I'm giving it a little bit of pressure, not much, until I feel almost like a click. There's no sound, but it feels like it's clicked in place, like a combination lock that found its number. And then I'll just bring it back to center, and immediately I feel a relief here on this lateral side. But now I'm going to retest. I'm going to rotate it left, rotate it right, and now they're exactly the same. Now, everybody can get tape somewhere, Kines tape, whatever. You could tape the whole knee. I use rock tape. I'm just going to tape the lateral side. So I'm going to tear off an end, and this is to help give it a little bit of help over the next couple of days as it's healing. So I just anchor it, and with my knee bent, because I need to have my knee bent. And I say stretch it across the injury. I stretch the tape. A little long. I don't quite need it this long, but that's okay. And then I give it a good rub, like so. And then if I didn't happen to catch the right spot where it was hurting, I could do it again. Now, a correct knee taping is to do the other side, same way, and then you tear and you put a tape across the center. You can check on YouTube how to do that. But I'm just showing simple, quick and dirty. Let's get this done. And especially if you have behind the kneecap pain, you'd want to tape the whole knee. All right, or if you had pain on both sides. Then you can use your chair. Let's assume you're not in too much pain, but you're going to bring your feet in, your knees are going to be straight ahead. One of the reasons why we get this issue, besides past injuries, is that the glutes aren't firing. And the glutes could be firing because maybe you've had a disc-related injury in the past, maybe you've had something going on, maybe you just sit a lot, and our glutes have got gluteal amnesia. Now, you're going to press your feet into the floor. Turn back so you can see. And best to be in bare feet. I'm in sock feet, so I might slip here, but I don't want to be in sneakers. I want to be able to feel the floor. I want to feel the base of my toes. That's my metatarsal arch. And the inside of my heels. That's what's pushing into the floor. Push into the floor without letting my knees cave in. And if you have to remind you, put your hands there. Push into the hands. Now, in the beginning, you may need the armrests of the chair to push you up, or for balance. And if you want to use some Nordic walker sticks, go ahead for balance. And then slowly come back. Keeping the feet straight ahead. Don't let the toes turn out. Now watch that, because what'll happen is your weak side, your toe will turn out. Straight ahead, come on up. Make sure I'm pushing metatarsal arch in and inside of my heel. Push up and slowly down. Now, how wide are the feet? Hip width apart. That doesn't mean these hips. Your hips are in here. So actually my feet might have been a little bit too wide. My baby toe, second toe should line up with my hips, which are in here. So here I go. That's much better. And back down. Now, once I do 5, 10 of those, whatever you're comfortable with, then I'm going to try single leg. I know this is probably my weak one. So I'm going to do weak, strong, weak. You can use the armrest to start. You don't have to lift the leg up in the air. Just, maybe you come up on your toe, because you're not going to push off this leg at all. All right leg. Well, this side looks like left to you, but it's my actual right. And then come down, just reaching for the chair so I don't lose it. And up and down. Any pain in the knee? No, no, no. If you're pushing with your metatarsal arch and in the inside of the heel and using your glute, your knee will be okay. But in some cases, that knee is saying, no, 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 not yet, not yet, not yet. Maybe you need a higher chair. Maybe you do this on the floor, lying on your back and just pushing your bum up and down. All right, so now I'm going to do the other side. Inside of the heel, metatarsal arch. I don't have to lift that foot up off the floor, but I don't have any weight on it. Making sure I don't feel anything in my knee. Careful that I don't plunk down, that I lower myself down. Good, last one. And then I go back to the weak side. Whatever your weak side might be here. Whatever your weak side is. Weak, strong, weak. Up. And you can do it with just touching, not having a seat. Metatarsal arch, inside of the heel, making sure you're feeling it in your glutes. Not in the knee, in the battissimo. There you go. Give that a try. Hopefully you ward off some knee nasties. Take care. See you next time.